reflections on the election campaign, I do think that there was a lot of scaremongering about the NHS, but I also think after an election it's important for the Secretary of State that actually takes up that job to reflect on whether there was merit in some of the things that his opponents said. And I think that the Liberal Democrat emphasis on mental health throughout the election campaign was absolutely commendable, and I am determined to carry on the fantastic work that was done by Norman Lamb when he was a minister working for me. And although I disagreed with many of the allegations that were made by the Labour Party, I do think that their emphasis on the importance of health and social care integration at pace is also something really important, and we need to make sure that that is reflected. It's always been a big part of our ambitions, but the doing it at pace, I think, is something that we really need to now make sure happens. My biggest frustration, I think, was probably not with my political opponents, but with some of the commentators in the media who said all the politicians are ducking the big issues with respect to the future of the NHS. I actually think that was extremely unfair. I think we had very big discussions about things like structures, the role of the independent sector, the role of the traditional NHS sector. That is a very, very important issue, and we had a very big and full discussion about that. We had a very big discussions about the pros and cons of reorganisations, which I think many people here will also have very strong views about. And let me just confirm here and now, there are not going to be any big reorganisations of the NHS, but that was a very important discussion to have. And we also had a very big discussion about money and what was going to happen, and who was going to find the 8 billion and where it was going to come from, and that kind of thing. And that's a very, very important discussion, the question of resourcing. And that was aired. I would have liked to have seen more of a discussion about quality of care, which I think is really, really important going forward. And certainly that's something I intend to continue championing. But I think we did have some very good discussions. In terms of what I plan and what the government plans, I hope everyone here appreciates the significance of the Prime Minister choosing the NHS for his first major speech post the election. And I think that we are very committed to implementing the 5-year forward view, the NHS's own plan for the future. But I think the debate now does need to move on to whether politicians are prepared to come up with the extra money. We've said we will fund the forward view, and we will find at least the 8 billion that is necessary. But we now need to move on from that discussion about what's going to come from the taxpayers, where there are absolutely huge pressures to tackle the deficit. In part, that 8 billion is going to come from cuts in other government departments, and we have to understand that there is only so much the NHS can reasonably ask for in that context. But we need now to move on to the other part of the forward view, which was the 22 billion of productivity and efficiency savings, and to have a much more detailed discussion about that element of the forward view, and we need to do that quickly. And of course our priority here is to eliminate waste, make efficiency savings, and improve quality at the same time. This has to be a process that at all times is improving quality and access, which is what we're all committed to. In terms of my own priorities, I intend to continue with some of the priorities that I had before the election, the focus on improving access to good cancer care. We have Harpal Kumar's task force with some excellent recommendations, and we want to continue to progress that. I want to continue, I think, some terrific progress on dementia, but I still think the quality of dementia care is very variable, and I think we've got much, much better at diagnosing it, but I'm still not confident that when people get a diagnosis, they then get the first-class care and support that they and their families need. And I intend to continue my relentless focus on that journey towards making our hospitals the safest in the world. And again, I think we've made some extraordinary progress, but having had that big shock from what happened amid staffs, it would be a real tragedy if we took our foot off the pedal there, because I think we have an opportunity to blaze a trail across the world by being global leaders when it comes to reducing avoidable harm and avoidable deaths, and I want to make sure that that is a crown that we have as the NHSs. But I do want to have a couple of new priorities on top of those going forward. The first of those is going to be a focus on a big new public health agenda around obesity and diabetes. I think at the start of a parliament you have a chance to put in place a national strategy to reducing diabetes and indeed particularly childhood obesity, which I think is a great scandal. The fact that 1 in 5 children leave primary school clinically obese is something that we cannot say that we accept, is something that we're prepared to live with, and we absolutely need to do something about that. And I also want to have a very big focus on general practice, which I think is perhaps one of the most demoralised parts of the NHS at the moment. But if we really are going to move to the system in the forward view that talks about prevention rather than cure, then we need to find a way of empowering general practice, of addressing the issues of burnout in general practice, of making sure that what GPs do is aligned with what the whole of the rest of the NHS needs to happen, and indeed significantly improving the capacity of general practice, the numbers of GPs. And I know that's going to be a challenge, but I think that needs to be a real focus if we're to deliver those objectives. Final comment I would make before taking questions is that underlying all of this, at the start of a parliament, at the start of a 5-year period, you have an opportunity to sometimes ask big questions, fundamental questions. And I think it's really important that we keep challenging ourselves and asking whether we have the right culture across the NHS. And this was, I think, a debate that was probably started by what happened at mid-staffs, but I think has become much, much broader than that. And some people say, get the policy right, get the funding right, and then at the end of it all, let's ask if we've got the right culture. But it's not like that at all. You have to have the right culture right from the start if you're going to be able to implement the policies that you know are going to work. And I think there are still areas where we don't get the culture right in the NHS. I think there is still a focus on targets rather than outcomes as the key metric of whether the NHS is performing well. I think we felt that in the winter, where there were huge pressures, but there was also a sense in the country that the entire success of the NHS boiled down to whether the 95% target was hit that week. And important though that is, it shouldn't be lost on people that even in the last year where we didn't hit the target, our A&Es are the top performing A&Es anywhere in the world, of any country that measures its A&E on a national basis. And we need to have a broader measure of what success is in the NHS, and we need to do some careful thinking about how we achieve that. So that's my starter for 10, but thank you for inviting me back, and thank you to the NHS for having me back, and I'm very happy to answer any questions that anyone may want to answer.